Buffalo County Wellbeing Collaborative. Glad to see all your faces or screenshots this morning. I'm Denise Sweener, Executive Director of Buffalo County Community Partners. I am filling in for your fearless leader, Travis Gregg. He's got a sick kiddo this morning, so you are stuck with me. So I'm going to try my best to sound more like a volunteer than a staff person today. I'll do my best, but we will miss Travis because his insights and logic are amazing. And so we'll get connected with him next time. We also have been talking about bringing in either a co-chair model or a vice chair model to help support him in this work as well. So I would like to invite all of you to go ahead and drop your name in the chat, as well as just, your title or just something unique about yourself to help introduce you to the rest of the people on this group. It is so nice to see you all this morning. It looks like we found a time that works for most of you, so that's fantastic. I am going to hand this off to the board chairman, Nadia Saeed. We have spent quite a bit of time, we being the Buffalo County Community Partner Board and staff, in talking about the role of the backbone to support all of you as a steering committee. And so we thought we would start off with just talking a little bit about what we've seen happening with the board and the backbone. And Matt, maybe before we go any further into that, let's just bring up the structure piece just to refresh our memories on that backbone piece that you guys all have been looking at. And then also our meeting objectives, and I should have the agenda in front of me, and I'm sorry I don't. The objectives, I think I can remember most of them, is to ensure that we start a process towards defining or placing some definitions in front of us for the steering committee. What's our roles and responsibilities for the steering committee? So to begin to get to that today, again, I want to ask Nadia to kind of talk about that bottom blue box, which is that board structure and some of the conversations they've been having, because they really want to be able to build a structure that really supports your work. And Nadia, without any further ado or repeating myself again, I'm going to just hand it off to you to talk a little bit about from your perspective of what you're seeing happening with that backbone.
Thanks, Denise. Good morning, everyone. Thanks for joining us. Brief background. So the board spent the better part of 2021 having conversations with service providers in all of these areas. And our focus was on collective impact. And so now in looking at the work that has been done and moving this work forward, we really started to take a look at the functions that exist, and the function and the structure that we would like to have in place in order for this process to work in the most effective and impactful way. So we started looking at our different committees within that backbone. So we have planning and measurement, we have a resource committee, a strategic planning committee that is newly developed, and then our executive committee. So the questions that we were asking is how, and it all comes back to the funded prevention strategies. How do all of those parts and pieces fit into and under that backbone, and then transfer out into the steering committee, who can then monitor, that's not a great word, who can then oversee the work that is happening within those work groups and ensure that the middle of that flower that you see there is that the impact. So how can this be the most impactful work? So the structure that we were looking at the board level is how all of those pieces play. So whether it's staff capacity, population health outcomes or performance measurements, the community investment, fundraising standpoint, how we can continue to monitor gaps, engage members, and be a tool of communication for the community. So just so that you know, as you move into this work, the backbone is committed to continuing that work and support on that end. So we just want to ensure that all of those considerations are in place. We want to be a partner for the steering committee. We have board members currently on the steering committee. So Matt Lohmeyer, Ken Schaefer, myself, Kathy Gifford, and Amanda Shoemaker are currently on the steering committee. So we do want to make sure that there's that cohesiveness between those, and that we can provide as the support needed for the work. Another conversation we had was about resources. So, you know, the resources that we have, additional resources that are available to support this work, so that we can provide that information to the steering committee as far as what we can commit to. That was too many C words. So I think that is it. Denise, did I cover that all? Does that make sense? Does anybody have any questions as far as?
And I think one piece to add to what Nadia has shared is just a staff perspective as well. So I'm just going to tell that perspective in a story frame. So let's talk a little bit about actual funding that Buffalo County Community Partners is responsible for. So they would have Region 3 block fund dollars to support evidence-based prevention strategies to reduce substance abuse. Those are funded strategies that directly connect to that impact in the center circle. So we're thinking about what staff support follows those funded strategies, how those funded strategies fit into a bigger picture in the larger community, and then how that work can be woven together with other great work in the community, other people doing that work. So for example, one of the things the staff started talking about, just to give some clarity to it, because we just keep thinking of different examples to help us kind of ground ourselves. Wanda Fedorchak would be funded in that grant to ensure that evidence-based practices are being accomplished in the community. Within those evidence-based practices is a prescription take-back strategy, which is evidence-based, and there's funding for that. It'll be coming up in April. It's been sponsored by Positive Pressure for many years. So Positive Pressure begins to roll up into that purple circle of children and adolescents. That funded strategy comes into that conversation with many others. They share that impact with others. And then you begin to ask if that's a key piece for the community, how does that also help to support food insecurity? How does that, what other information about substance abuse prevention needs to be going to early childhood? Another interesting piece is a gap that we've talked about of those with brain injuries in the community. And we're starting to see some interesting funding and connections to brain injury and drug overdose. So we're just starting to have those types of conversations about how all this work weaves together. So the board's really paying attention to those things that are funded right now within the organization, and then how we lift that up into this model, and then also support the steering committee, who you guys are most likely going to be looking a little bit more broader than what we are with funded strategies. You may see other strategies coming to the table, like I'm thinking of Megan here with Boys Town. I'm sure there's strategies that Boys Town's doing that are evidence-based that fit this work that would be well worth our conversation about how we're all working together on that particular impact of reducing youth from entering the system or re-entering the system. So any questions about the conversations happening between staff and the board and that backbone? Everybody's in the right meeting. Feel free to throw some chats up there too. If you're like, great job, love the conversations, or boy, I've been thinking about this question, feel free to throw those out there. Or if you just want to say, I still don't get it, we're with you. You can throw those types of comments out there too. So next I want to travel. I'm going to take my staff hat off and start talking a little bit from the perspective of what Travis would be saying if he would be able to be with us today. What he wanted to make sure is to bring us all back to that center circle of impact and kind of bring us back to where we left off at the last meeting. So at the last meeting, we refreshed ourselves and said, okay, we've, as a steering committee and a backbone, we've agreed that we're going to adopt the collective impact model. We've agreed together with this dual accountability. I think we've been kind of using that word back and forth, a dual accountability between the steering committee and the board, that we're going to use results-based accountability to ensure that we're making progress towards the impacts in the community. We've also seen the work that Travis and I think Judy Sickler and there's a few others who put together a Buffalo County Wellbeing Indicator list. So we have that list of data put together and available. From there, we created vision statements, like Nadia said, by inviting people into the board meetings. Many of you were those individuals that come into the board meetings and said, this is our hope for this work in the community. And we captured that into vision statements and then a list of gaps within those vision elements. And then we, at the last meeting, presented to you all those funded strategies from Buffalo County Community Partners perspective, just to keep in front of us. And what we asked you to do is to break up into two subgroups. And so one group was behavioral health and children and adolescents. And those of you on this group broke up into that group. And then the other group we brought together was vulnerable populations and access. And so we had two work groups of those of you in this call, and we asked you if you could put your finger on an impact, what would you like to see amongst your work and the work of others in the community? And you guys nailed it. I have been talking about how successful you guys were in that meeting. In 15 minutes, you walked out with two very precise impact statements. And those impact statements are on your agenda. The vulnerable populations and access group come back out and you said, our suggestion for an impact statement would be to increase access and increase access in programs, services, resources. That was what you come out of very clearly stated as an impact statement. The behavioral health and children and adolescents, you come back and very clearly said that you wanted to reduce children, youth, adults, families. You wanted to reduce persons entering the system or prevent youth from entering the system, preventing a child from entering the system, preventing an adult from entering the system. And then the staff has been talking a little bit about adding re-entering the system, right? Because we may have someone that's working to, has been in the system and working to prevent from re-entering the system. So anyway, two very clear impact statements. So good work. I mean, honestly, pat yourself on the back because that was amazing work that you did last time. And then as we walked away from the last meeting, you said, how do we begin to define terms? How do we begin to define responsibilities? What is the steering committee going to be focusing on? What's the backbone going to be focusing on? And so that's what we want to spend the rest of our time today with you talking about. So a couple of things that we have been tossing around, and it seems to us, and this is just kind of a checkpoint with all of you, it seems to us that the steering committee is most likely very focused on the impact, right? You're going to be really attentive to whether that impact is getting accomplished or not. We also think you're probably going to be fairly focused on other things coming into that collaborative that the backbone is not bringing to the table, right? Who else in the community is doing this work, and who do you need to be attending to outside of just Buffalo County Community Partners work? And then how do you discern what that work might look like moving forward? You know, what capacity does the collaborative have to move forward with new emerging pieces? Or where's your priority focuses in the work of the collaborative? So that's been some of our preliminary conversations since we left all of you last time. And then I have here just a caveat to go back to Dr. Duffin. And I don't know, Matt, if you want to stop sharing the screen so we can kind of see Dr. Duffin as well. Is she with us? Yeah, she is. We kind of wanted to have her just give an example of the conversation planning and measurement's been having, and that's a board committee. So this is some of the conversations they've had about how do we support the collaborative and the steering committee when it comes to that committee. So I'm just going to pass this off to Dr. Duffin.
Okay. Good morning, everybody. Thanks for joining me. Thanks for the time here. If you notice on the chart that we just had on the screen and as part of our agenda packets, the Planning and Measurement Committee is part of the backbone. It's a board committee. So the committee itself is made up of board members and community volunteers who have an interest in the work and in playing with data, because that's just kind of how we are oriented, right? We shared the adoption of results-based accountability as the model for guiding the planning and measurement work that goes on, through Buffalo County Community Partners, through the backbone. And if you remember that results-based accountability is based on us using data to answer 3 questions, right? What are we doing? How well are we doing? Is anybody better off? Right. And those first 2 questions, the what are we doing, how well are we doing, it is really program oriented. That's what's going on in the programs and the people who are being directly served by that. The third question, is anybody better off? That's really where the Planning and Measurement Committee sees its work centering. And that's focused primarily on population level data. Can we look at what's going on in the community and see the numbers moving in the directions that we want them to move? Okay, so a lot of the conversations that Planning and Measurement has been having lately is, well, we don't know, we don't have answers yet. So the conversations are ongoing is, how do we take what we do and support the work of the steering committee, support the work of the collaborative? In the meeting that we had, just for an example, the meeting that we had the meeting we had on Tuesday, which was the March meeting, we're starting to figure out a way to develop a procedure or a model for how we can disseminate the data that Buffalo County Community Partners routinely receives. There's a regular batch of population level data that Buffalo County Community Partners gathers, and we want to figure out, hopefully with the help of the steering committee and the collaborative, how we get that data into the hands of the people who can use it, because it doesn't do Buffalo County Community Partners, a limited amount of good for BCC programming, but for the most part, the goal here through the collective impact model is to get that data in the hands of anybody who can make good use of it. So a lot of our conversations lately have been around, right, how do we develop a process for doing that, and who's going to be facilitating that communication and deciding who needs to know what. Probably the last thing I'll say is that the goal of the Planning and Measurement Committee has become to provide a resource for the steering committee and the collaboratives. We'd like to kind of position ourselves as a clearinghouse for the data that all members of the collaborative are gathering on a routine basis, so that it could be centrally located and shared with anybody who wants to look at it, because I think that's a key piece of a collective impact. So we're kind of working through the steps of figuring out how we're going to do that. But we certainly would hope that the steering committee and members of the collaborative would also tell us what would be useful to you. What do you need? How can we support that work? And I'll stop there. Thank you, Denise.
And one note that I'll add is that at our last board meeting, we did talk about a new committee that would focus on combining that work that Planning and Measurement is doing, and then help to engage members and engage new members in the community, and just improve that the communication for the collaborative with the community. They would help to monitor those gaps. So we are talking about a committee that would be focused on planning, engagement, and communication. So.
And as a staff perspective, to give just an example of the complexity of this, but still the simplicity of what I think we can get to, is Dr. Duffen's talking about all these different pieces of work that are happening in the community. For instance, we have a developmental asset survey that just come out of all the schools that we conducted, and it's great information for those youth serving organizations. So how do we lift that up into the community, and how do we help prioritize that work? We also, Tana Miller has brought to our attention that our evaluator with our Partnerships for Success is ready to share data on how successful all of those strategies within that grant have been. And so how do we share that information in bite-sized pieces? And I just keep wanting to bring Doug Kramer into this conversation too, because he's got the whole juvenile justice plan throughout the entire community. So that's not necessarily a funded piece from community partners, but it's a funded piece from the Buffalo County Attorney's Office. And there's some great data coming in to play there. And what's so awesome about all this data and all this work is ultimately the impact that all of these funded pieces are wanting to do is to prevent youth from entering the system. So you landed on a fantastic impact statement when you kind of start to play with that data. And so that's one of the things we've been talking about. How do we not overwhelm people with data, and then just really be focused on what data is essential and what partners are bringing that data to start weaving together those conversations. So thank you for that, Diane. So the next piece, that was a staff perspective. I'm going to go back, and hopefully you guys are keeping track of my seesawing back and forth. I'm going to go back to the Travis role. So if Travis were with us today, he would, I'm sure, be thanking you for being here, right? And making this an important part of your community. Reminding you that this is your committee, right? You're a member of the steering committee. You're seeing all the support that the Buffalo County Community Partner Board is bringing. Travis is not actually on the Buffalo County Community Partner Board. He's doing this really as a dual role between that backbone and your steering committee. So he's really excited to be the leader of that work. And so we started to begin asking questions in some of our planning meetings, and those questions to help define your role and the definitions of the work that you want to address as a steering committee. We began to ask, what are the things that you will be most attentive to, right? What are the things that you as a steering committee are going to be really looking at for the total collaborative? And then how will decisions be made? How will you be making decisions? And then you heard a little bit from Diane and Nadia, the board's preparing for when you ask the board for help, right? When you're asking us to help support any one function, or maybe you need some staff support to put something in place, we're preparing to figure out how to answer those questions for you as well. So again, we feel like the impact statements are the things that you're most attentive to, but we want to check that a little bit with all of you today. So the questions are, and they're on the agenda, right, Matt? How will the steering committee interact with the backbone? Okay. What work will the steering committee be most focused on? And then will members of the steering committee lead or find the leadership for these work groups that would start to begin meeting within that full collaborative? And it feels like I should mention that the next large collaborative meeting will be next Wednesday, starting at 12:30. And I believe, Matt, right now we have about 50 so people registered to attend that meeting. We're still doing quite a bit of PR pieces. And at the end of the meeting, we're going to encourage you to also reach out and invite people. And so at that meeting, they haven't seen the impact statements. So that's the one thing we want to bring to the collaborative. And we want to look to all of you to see if there's some of you that will help us present that information to the full collaborative as well. So just a little segue there. We also talked about just doing a little walkthrough to help answer some of these questions. So if you bring that model back up on screen, Matt, and if you begin to consider which one of those circles you maybe live in, and it's okay if you live in more than one circle, right? I think I told the board at the board meeting, I'm putting you in boxes, but it's not that you need to stay in the box. It's just for the sake of being able to start defining what we're doing, we really need to look at this model from your perspective and your organization and what you're bringing to the collaborative. So as you find yourself in that circle, you're thinking about all the other partners that you want to connect with and what those connections might look like, and then how you're all working together to achieve that impact. So for the board and the staff, I'm going to kind of step into that role for a minute. If we were to look at that children and adolescents purple circle, we've got several coalitions that fit in there. So if you're on this call and you're a member of Positive Pressure, we see you in that purple circle or oval. If you've been on the prescription opioid prevention, we see that work in that circle. If you're on an early childhood collaborative, we see your work in that circle. If you've been on any of our connected youth or youth services, the pieces funded by the county attorney's office, we see you in that purple circle. So as a staff, we've been starting to talk a little bit about, is it time to start moving that purple circle into some action? And if we do, what would that look like? So it's been kind of a talking point for us to be able to put some real structure to the conversations. We haven't decided to move that forward, right? That's kind of this dual role between the steering committee and the board. When is the right time to do that? And what are the things we need to have in place before we start that process? And the staff is trying to work that ahead of all of you too, just to be thinking about all those pieces. So hopefully everybody's been following along with us. I want to just take a moment, pause. I want to do just a quick count. I'm doing a stop sharing again, Matt, so I can see everybody. We've got 23 people, probably about 10 staff. Let's try to do this as a group. I think we can do this as a group, but we're going to do some questions, and I'm going to bring up a Word document and begin to just track what I'm hearing from many of you. If you feel like you'd like to just raise your hand, I can call on you that way. Or if you just want to mention the chat, we can go that way too. Or just shout it out. We're okay. So what do you see most important that the steering committee will be focusing on? I've given you some thoughts that we've had, but those may not be the correct answer. So ultimately, what is the steering committee most attentive to? And I'm going to be quiet and let you kind of answer that.
Well, I'll jump in. I don't know how to articulate it though. The nice thing is having you guys as our backbone is it keeps us on tasks just because we have other lives and jobs outside of this. So I think just supporting us and giving us deadlines and just keeping us moving. I'm kind of approaching it backwards, I guess, but that way we can do the work. But if you guys can help us with the back office part of it, if that makes sense.
I'll take a crack. And Judy's comments send my thoughts off into two directions. One is to the steering committee, I guess, represents the collaborative to the backbone, tells us what the collaborative needs, what the collaborative is accomplishing. So it's kind of a communication conduit, I guess. And then the other direction my thoughts were going into was the word I was looking for was accountability. Was to and I think Judy was alluding to that too, is to keep the collaborative moving in the directions toward the goals that have been set, and paying attention to the outcomes and see if we're gauging the ability to reach those goals.
I think too, just to help avoid duplication and to identify holes in our current community network.
I think that the steering committee may be the ones who help to identify who could carry this on in the rest of the community too. Would help us with that a lot.
And I don't know if you can see the chat box, but Abby dropped into initiating the work in subgroups.
I always hate to be the one to stick my neck out and ask questions, but I always think that if I'm asking the question to myself, maybe somebody else is. So is the work of the steering committee, is it intended to be a long-term, or is this a short-term as you're planning this transition and this, like, what is the long-term plan for the steering committee? Because I think if it is a longer-term part of the plan, then, just the word steering committee to me means we're going to adjust the plan as we need to, maybe adjust the goal or adjust based on the outcome, and just really kind of steer the work where it needs to go.
Well, and I've seen steering committees over the years with other organizations. Sometimes they just don't have enough capacity, whether it's time or whatever, to be involved in the work, but they help drive it. So they, like you said, they steer it, but they aren't necessarily the worker bees. And yet you also have people in the steering committee that love to do the work. So this allows them to be part of something bigger, like the overall vision, if that makes sense. I don't know if that's our collective vision for our steering committee, but I've seen that with other organizations, churches, groups that do fundraising, like for a big campaign.
Moving into that uncomfortable pause, right? All really good information. Lots of good stuff to think about. You noticed I didn't jump right in to answer any questions because I really want this to be the work that you guys put that frame around, right? What you're comfortable with. How might you make decisions? I think that's a piece of it too. And what do those decisions look like? I guess I have it listed as how will the steering committee interact with the backbone, and what decisions might you make, or what requests might you make of the backbone?
This is one of the more challenging pieces, I think. I sit on a couple of different groups, and there's no real laid out way that decisions are finalized or made. And so what often happens is that the people who are quiet may have something completely different, like a different thought, but it's not being voiced. So whatever this looks like, I would highly, I don't know, encourage, love to see. It's super important that this be decided, how these decisions are made, so that everyone has a voice of some kind, even when they may not feel comfortable in sharing that. So the direction is clear, I think.
Thank you, Jamie. That is a conversation that we have had, and we really are looking to this group to voice their thoughts in how this works. I know you've all been involved in many coalitions and committees. The conversation that we've been having over the last year is how can we increase impact? So, really we're looking to your expertise as the steering committee and the work that you've done to say, how can this collaborative be most impactful? What are the pieces that need to be in place? And if the steering committee doesn't have the authority to make those decisions or steer, if they're going to have to defer back to community partners in all of those conversations, then is it really the most effective? And so I guess I know that we're asking you to think a little bit outside of outside of the conversations that we have had, but as you think about the work that needs to be done, the work that could be done, what does that process look like from the level of a steering committee? How do we be most impactful, but yet really clear about the structure and the process of those decision making? Is that a matrix? Is that a some definition of those those processes? So thank you for speaking up, Jamie.
This is Kathy, and when I look at the definition that we have on there, it says provide strategic vision and support to ensure full collaborative has what it needs for success. It's almost, and the way the drawing is, it seems like the steering committee is the liaison or the group between Buffalo County Community Partners and all the groups. So they would have to, the way the drawing is and the way the definition is, it seems to me like they would have to go back to Buffalo County Community Partners to make sure that there is the support that they need, unless they have somebody in the community who's going to go over and just take over and run with it and not depend upon something from Buffalo County Community Partners, which we've talked before that could happen. That's what gets confusing to me, is when do they get to say, when do they have to come back? Because that's the way the drawing is, they're a liaison between the two. And when do they say to some group, go for it, you're on your own? I don't know that answer.
I think it's important that there is a strong tie back to communities, partners, staff, and board for the accountability, for the oversight, just to keep us in line with their mission so we don't have mission drift. And honestly, if they're the fiscal agent, they need to know what we're doing and make sure we're staying in line with their funders, right? Because that's so easy to go down a path and then you're like, ooh, that's not gonna be covered by the grant or whatever. So I almost feel like we're the eyes and ears of the community, one step removed from the organization, and then whatever we can bring to the table, great. But it just gives you a different perspective, maybe, to be one step removed. Does that make sense? Because we might ask some questions that maybe are a little uncomfortable, like, do we really need to be doing this work? And that's awkward if you have staff doing that work, right? So do you pivot them into something else, or does that make sense? It's just almost another layer of question asking, and I don't know, maybe I'm wrong too, but I think there's that possibility as well. I don't know how to do this so it's not overcomplicated and makes it another job for all of us, right? I mean, we're all very busy people. So how do we do all this complex work, but yet make it simple?
My input, I guess, probably goes with this question and the previous one, but I think the steering committee needs to do something in a timely manner. So all of the people under them or around them or with them see that something's happening. Again, it probably goes back to your timely stuff, Judy, that I'm on a lot of groups and committees, not just through Buffalo County Health Partners, but one of the things I guess I've heard over the years is what are we accomplishing and when do we accomplish it? So there needs to be some type of a marker that shows, yeah, we're making steps to do the things we're saying we're going to do.
Again, I think we've moved into an uncomfortable pause, so I'll take us to the next question, but always very willing to come back and add more to any of the work that you've already put on the page. The next question, and I think you got to this next question a little bit, and a couple of comments. I think maybe it was Judy that said she's on some groups where the group may not be workers, yet some are. And so trying to define that a little bit more. So the next question is, will the members of the steering committee lead the work groups? Or are the members of the steering committee finding the leadership for the work groups? And so what's your engagement between the steering committee and the work groups? So it's that tie. We've been talking a lot about your relationship between the steering committee and the board. Now we're asking between the steering committee and the collaborative and the work groups. Is the question too vague? Do you want me to give some more examples?
I wonder if it couldn't be a hybrid. Like I guess I would see, having some leadership outside of this steering committee because of what Judy had mentioned. But maybe someone on the steering committee is pointed to work with that leadership team and kind of mentor and help guide and support the work that they're doing in those different subcommittees.
Denise, I'll just share out to what is in the chat box. So Abby had said finding and kicking them off as a rep of the steering committee. And Kathy had shared steering committee might be the group who almost acts as a triage for whatever the concern is, send it to a group on their own, refer to community partners for funding, or some combination. When BCCP is identified as funding, then there's a great need for accountability. Emily had just shared, she agrees with the hybrid, definitely something with a steering member involved, but also needing someone with firsthand knowledge of the work being done in the field. And I think as a staff member perspective, I think I fall in line with what Jamie had just shared and Emily just agreed with. I think it's great to have the steering committee guiding that work, but then it's also nice to at least have some leadership within the steering committee, also a part of that work group. So that way it doesn't get lost in translation.
And since I'm so totally inept of typing all that as you were sharing, I will grab that out of the chat and drop it in. How's that? You can see my struggle with spelling, my struggle in following directions. Thank you, Tana. I think you guys got some pretty concise answers there. You kind of like that hybrid, don't you? Any other thoughts?
I just want to say that I really liked Abby's earlier comment. And I feel like it applies to this question too. We need to ensure that all decisions or tasks add value to the overall picture. And so I think that that's what got us to this point is, some type of ability to monitor overall what is happening at those work groups. You have all been involved with coalitions, and sometimes you're just laser focused within that coalition, but yet not collaborating with other coalitions or other groups in the community that are doing the same work. So I see, and I don't want to speak up because I've been too involved in the planning conversations. I really want to hear your perspective, but I see that overall vision of the purpose within, whether it's within that work group or the bigger picture of the community, and then having the ability to review and steer that work group in the direction that will be most impactful. So thanks for all, I think all your comments were great, but I just wanted to stress that one.
I know our friend Joanna needs to leave here in a little bit. So I just want to ask her if there's any maybe summary of what you're hearing or other things you want to challenge us with, or just say, we did a fantastic job.
We always do a fantastic job. So let me start there. But I was just sitting here marveling that so often, I think in my career, and I bet for a lot of you, you get asked to do something and then you're told what it is you're going to do. And it's pretty cut and dry. And then you have your marching orders and you go off and do it. This is a very, very different process. And you don't see this that often, where a group of leaders are called together to discern together what it is that we need to do in the community. And it takes painstaking time. It really does. And you're being asked really uncertain questions. There's not a clear sort of answer to hear. And it's a little uncomfortable. At first, I found myself sort of sitting here saying, oh gosh, don't we just want to say, here's what we're going to do? And tell the group. And I'm so delighted to see you take the time for this kind of a discernment process. It rarely happens in leadership teams. So kudos and good on all of you. I think this is marvelous. And I think these are the kinds of questions that require reflection. They're not easy to answer. And so you might get a little frustrated at some point. But I think if you got these notes back and had the chance to sit with a little bit, you'll start to see the cohesion and the consensus that starts to emerge from a process like this. So I think it's okay to feel a little uncomfortable right now if you're feeling that, because I know I am. I'm like, oh gosh, how is this going to come out? Because I want this to be such a success for you. But I think going slow to go fast in the long run in this particular process is really wise. And Nadia and Denise and I spoke a little bit about So how does the board feel about this new entity coming together? And, you know, that deep need for the board to say, well, here's what we can offer, here's how we can support. And we kind of came back to, and it'll be an evolution. Just as someone said earlier, you know, as you discern what needs to happen, you'll have a better understanding then of what the lines of authority are, right? So I just wanted to comment that I think this is an excellent process, even though it might be a little difficult to not have all the answers right now. And if you go slow at this first part, I think you're going to go much faster on the back end. So good on you. Great job.
Thank you, Joanna. I appreciate that. And thanks for joining us today. I'm trying to think where maybe, I think we can probably wrap up a little bit early, but I do want to kind of talk a little bit about next week's meeting and then what you might want for your follow-up meeting. I'm going to throw out just some observations to get us thinking, but it is in no way, shape, or form a decision that's been made. So, for example, the staff has talked about those committees that I mentioned in that purple area of the children and adolescents. And so those coalitions have been meeting. We've been talking about bringing them together. We've been talking about who those leaders might be that could lead that group. I've been throwing out two names over and over again, just because I can see them and they just wowed me the first time we sat down and started talking about data. And that is Chief Waugh and Neil Miller. And I remember them both just standing up, not standing up, but on a call saying, it was just kind of a revelation. Like, everything you guys are talking about is what we want for our community. We can see how it all works together. And I don't know that they are the people to lead that group, but I just throw that out as an example. So if we were to approach two individuals like Neil and Chief Waugh, what would those conversations look like? How would we support them in that leadership? What would those agendas start to look like? And then is that the place we start, right? So those are kind of the place that we're at as staff, but I think it is always helpful just to give some examples about how this might move forward, just to keep us thinking about some of those elements. And you could do that in each one of those circles. So I think that's kind of coming back to the steering committee, right? What do we have the capacity to do? The board's talking about that, right? The board's going to try to help inform that work. What do we have the capacity to do? Right now, we're hearing from those funders and those groups that they would really like to get that work started. So that's kind of why we keep using that as an example. So any other thoughts before I begin to ask questions about what you would like from your staff team and the backbone before your next meeting? And then we can maybe kind of talk a little bit about what our thoughts are for the full collaborative meeting. So any other observations, thoughts that we want to capture?
I do like the idea of two leaders, just in case one's not available, and it also gives two perspectives to that leadership. I wonder if they both have the law enforcement lens. You know, would it be better if one's law enforcement and someone else maybe is the school system? I'm just throwing it out there, just so you have two different approaches. And maybe it's not a big deal, but I love the idea of having two for sure.
Well, and you know me, I can't help but hop in when it's something like this, but I think it'd be really great to have a family perspective, to have someone who has some lived experience in these different areas that might be interested in participating in guiding that work too. So.
And I think I'm hearing from you too that you feel that you could help provide that support to that leadership team, right? That there's kind of a hybrid approach. There might be some of you that are willing to lead one of those groups, work groups. And there is maybe some of you who want to just meet with that leadership group and make sure that we're connecting on what the agendas are and what we're wanting to get accomplished. Of course, with staff support and the backbone as a part of that piece.
I do like the idea of having two different people from different backgrounds in that leadership role. And then as a steering committee member, we could still provide, in my field, we call it TA, technical assistance. So then we can still be that liaison for them.
Okay, next question. What would you like from the staff and the backbone for your next meeting? How can we support your process?
Can we start with this purple petal of children and adolescents first and kind of have them be our guinea pig before we roll it all the way out, or our little test, a pilot of it or something? I don't know, just a thought in case we want to mix it up before we spread it out to the other 3 petals of our flower.
I think that's a conversation we've had several times in different places, just to do one and do it well and figure out that. So I agree with you, Judy. The other thing that somebody mentioned, or several people have mentioned, liking the 2 leaders. Do we have names of other people? I mean, there were a couple of people that mentioned we needed somebody with a lived experience and some, something like that. Do we have any suggestions, or does the staff have suggestions of other names of people to give to Denise?
That's a good idea, Kathy. So maybe between now and the next meeting, sending us some ideas of who some of those leaders could be. And Jamie, if you have somebody with lived experience that you think would be ready for that opportunity, we definitely want to consider that as well.
Sometimes, just one more thing, those people who have those lived experiences or whatever other may not even know, they wouldn't come forward and volunteer, but if we were able to contact them and kind of explain what we're trying to do, which is a lot, but it might be something more intriguing to them rather than for them to just jump in and say, oh yeah, I'll do it. So anyway.
Well, and I don't know, Denise, if you have some time this evening, but we are meeting with some parent leaders this evening. And, we do share these opportunities with those parent leaders who have been trained and are ready to do some of this work in their different communities. But I don't know if they quite conceptualize what it looks like. So anything this group can do to kind of explain what that responsibility looks like, what the impact will be, why it's valuable, why their voice is valuable. That's kind of the big, I get paid to do this stuff too, although I'm a parent with lived experience, right? So it's just difficult for them to see themselves in that role when, they think I have some magic power or magic dust to do this the way I do. So anything you guys can do to help me recruit them to understand what the work would be like would be helpful too.
Do you want to drop that information into the chat, Jamie? And maybe if there's some people that have that availability, I would be able to via Zoom. I don't know that I can do it in person, which I regret because I think some of that needs to be in person. But there might be someone else on this group that would be very passionate about that as well. So yeah, please let us know. Okay, so oh, go ahead, Abby.
Well, I don't know if you can hear me. Can you hear me? Okay, it might cut out. Maybe it's because I missed last meeting, but could somebody clarify like what types of families we're looking for? Like what, is it, I guess I'm not sure how to help when I don't know that answer.
Let's add that question to our next meeting, right? Family engagement is really, really important to this process. So how do we begin to engage those families and find those leadership roles, or at least that voice to be a very strong part of this work? And in the meantime, if anybody has time to connect with Jamie, I think that's a beautiful invitation. A great question, Abby.
Kathy, is there someone like in the administration at Kearney Public Schools that would be a good leader, or are they just swamped right now? I know there's been a lot of changes and.
Well, at the moment, they're pretty swamped, but we are in the process of hiring a director of student services, but that person won't come on until, well, actually, hopefully July 1st and be next school year, but that would be a good person that would be the liaison, I would think. And so we don't have that person identified yet, though. So, because we're restructuring the administration, so. I mean, we have our social workers and things like that, but I don't know if that's the people. They're pretty swamped, but.
What about Jason Owens? He's been pretty active with some groups, and he is
really active and he's really involved. And I don't know what his time commitment is with the Hanny Aram Center and starting there's some new programming that's supposed to be happening there. I'm not saying don't ask him or anything, and he usually has more of course, it's 6 through 12 contacts. So I don't know, which is all adolescents. That's part of it too. So.
Or maybe a recently retired principal or superintendent or somebody in our community, like ESU 10 or university.
Yeah.
I'm just trying to
talk to Jason, and he might have somebody too that he would recommend. He might have a parent that would be good. So.
I also appreciate Tana's comment about, there's plenty of schools around here as well in our county that we, may not need to completely burden KPS either, that we can get good information from the rural area as well.
So,
or Denise, can you pull up the model that we had at the beginning that has the backbone on the bottom?
I will wave my magic wand and Matt will have it appear. How's that?
So if you can just zoom in a little bit on there, I was just going to say, as far as, each of those work groups, our previous conversation, sorry, will you go to the underneath where it says full collaborative there? So our initial conversation was that, that box. Yep. The one that, there we go. Was that within each of these work groups, there would be representation from all of these areas. And so I guess, just something for you to think about before the next meeting. And if we're just going to focus on the children and adolescents group, is that whoever is a leader in that group, and whoever is we'll just call it liaison between steering committee and the children and adolescents group, would really want to make sure that is a list of representation within that group, that you have community members. So I don't know if it helps to start, if you're thinking about some of these, if it helps to start looking at that cross-sector representation, and starting with a list, and then who are the natural leaders within those groups that would rise to the top of that work group, and then simultaneously pair with the steering committee member. I don't know if that's helpful at all for thinking through the process, or the conception of, or a way to conceptualize how the work continues. Again, this is just my perspective, but because this really is your work, and so how do you see it being built in the best way?
I'm thinking too from that, Nadia, that would be a great piece to share with Jamie and her parent group that are meeting, to begin asking, who's most interested in prevention and supporting children or youth and adolescents from entering the system, and who has a passion around that area that would be willing to come to a meeting. And I think that might help start to build that trust and that understanding of what this work is versus trying to present the full model to somebody. They're going to tie more connected to the outcome, right? And how that impacts them. So I'm hearing the staff could probably put together a list of who's currently doing this work in by sector. I think actually Michelle's started a pretty good list of that already, because we've been having some conversations around that. We've also been trying to organize our donor software to be able to communicate with the group that you're going to be ready to launch with. And then maybe all of you could be sending to the staff names of people that you think would be good co-leaders. And we could be inviting them to the next meeting and encourage them to join us for this next conversation. The staff is also going to be talking next week about what some of the content of the conversations will be. What a structured agenda start to look like to help with those pieces as well. So did I capture most of what you'd like to start walking through? I think Judy said that. Let's just start to model one of these petals and see what it might look like, and go from there for your next meeting. Did I miss anything else that you'd like us to prepare for you to have a good conversation next time? Okay, then this is the last piece of your agenda, the Buffalo County Wellbeing Collaborative. And I hate to ask this question, Michelle, but are we going with wellbeing hyphenated?
I plead the fifth.
Okay, anybody weigh in on that major conversation amongst staff and board about wellbeing, one word, two words, or hyphenated? So if you have an opinion, send them our way. So the Buffalo County Wellbeing Collaborative. Oh, Kathy's got a comment.
I'm just saying one word. I was just putting up one word.
One word?
Yeah.
All right, one word. It's your collaborative, so you
Take a vote. I don't know.
We did vote on it a while back. Okay, so that Buffalo County Wellbeing Collaborative will be meeting on Wednesday, March 23rd from 12:30 to 2. So we're going to be really encouraging people to attend. Like I said, we have about 50 people in attendance. I am confident that each of you received an email from the staff asking you to join that meeting. So please send that on to a friend or two. If you, for some reason, didn't get at least 5 of those emails from us, let us know. We'll make sure you get that content to send out. We also will be presenting those impact statements to the collaborative. So this will take some subgroup work. Is anybody willing to do some of the facilitation of those subgroups? If you are, would you please put your name in the chat, and we'll work with you on some of those breakouts and language and things like that. So please, we'd like, a handful of volunteers, maybe 5 or 6 volunteers if we can get them. Let's see. So we're going to be presenting the impact statements for them, and we're going to be asking them if we've missed anything in those impact statements. Is there anything that outlies outside of those impact statements that we maybe haven't considered? And then at the end of the meeting, we have put together a list of collective impact questions that we felt would help us gain a better understanding of where we're at in the collective impact process with those who are attending. And I don't think I have those questions in front of me, but I think one question is, are there people interested in this conversation and wanting to come to the table? So we're hoping to get some sort of scale between 1 and 5 if people feel that there's some energy behind this and that they want to join the collaborative. And then is there mutually reinforcing activities amongst the people who are in attendance? And so those are some of the questions that we want to get out to everyone to give us a pretty good idea. And I think we can bring that then to your next meeting. And we're hoping that will help us have a better understanding of what content we need to be bringing in front of that collaborative for their next meeting. Your next meeting will be at 10 o'clock Thursday, April 21st. There was really no significant difference in Zoom versus in person. Most of you said hybrid, so we were keeping with Zoom. So unless anyone has a preference other than that, let us know. I think we would still like to do an in-person meeting here or there if we can, just because it's nice to actually see people in person. And I think that was all on my list. Anything I missed for today? Well, make sure and tell Travis that I did a very good impression of him. I know he really regrets missing this meeting. He wanted me to extend to all of you that this is very important to him. And he wants to be here being your leader and being supportive of this process. So hopefully next time he will be able to be here with you. All right, that's all I have today. Thank you for joining us. We appreciate it. Have a fantastic rainy day. God bless us. Please bring the rain.
Thank you.
Thank
Thank
you.
you.